My name is Valerie Page. I'm a consultant in intensive care medicine at Watford General Hospital. With our project, we aim to improve mental health outcomes in the relatives of our critically ill patients and their close friends. So less anxiety, less depression, less PTSD and less complicated grief, which we know is a burden to a lot of the families of our survivors and non-survivors. We aim to do this by it's a complex healthcare intervention, but in a nutshell, it involves three elements, one of which is demystifying the environment, explaining more in a more meaningful and accessible way about what's actually going on and why it's going on. It's about incorporating the family, engaging them into the unit of care. It's about providing them with an activity kit which they can use if they're waiting while investigations are going on or when they're with the patients, so that their visiting time they can have a sense of purpose, they don't feel quite so helpless, and they're engaging with communicating with the family, the patients, and we believe it may help them as well. And it's also about identifying and clearing up misunderstandings, which can be distressful and it can easily happen in this very highly fraught situation. We will ask them, is there anything we can do to help you today? And we will say, if you were to go home and explain to someone what's going on, what would you say? So we know what they understand. We're going to implement this at Watford General Hospital. It's already been used in the States, it's been used successfully, and it's been shown to decrease short-term anxiety. We're going to find out how acceptable it is to the clinical staff, to the nursing staff. Are they able to provide this level of communication and engagement? Will they welcome it, and is it transferable to the wider NHS? We've discussed this with family members and survivors of intensive care. They're very encouraged by it. They believe it's innovative and it would help enormously the situation that they find themselves in.